Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about renal failure. It is a disturbance in the renal function and it is a decline in GFR, which is glomerular filtration rate, rise in urea and non-nitrogenous substance in blood. This renal failure can be classified into acute as well as chronic renal failure. The acute renal failure is sudden, reversible deterioration of the renal function over a day or a week. It is rapid rise in blood urea. The acute renal function has a significance of rapid rise in blood urea. The chronic renal failure is long time. The word acute means it is sudden and it is reversible, but chronic renal failure is long time. Some underlying causes irreversible. There is no chance of getting reversed. It is a irreversible deterioration of the renal function for a month or a year. Cause is pre-renal cause. The cause can be separated into three types, which is pre-renal, intra-renal as well as post-renal. The pre-renal cause is before entering the renal system. There is any obstruction or any types of systemic illness which causes pre-renal cause. This is hemorrhage, severe burns, hypovolemic shock as well as cardiac failure and septicemia. More amount of blood is lost. So this is the pre-renal cause. And the intrarenal cause are intrinsic renal is vasculitis, the inflammation of the blood vessels as well as the renovalvular obstruction. The post-renal causes after getting out the renal, the urinary tract obstruction at any site. The clinical features are pre-renal, no history of pre-renal existing disease, oliguria and anuria. Oliguria means decrease in amount of urine less than 500 ml. Anuria, there is no urine is produced. Uricemia, due to the pre-renal is mostly due to the loss of blood. So, due to the loss of the blood, there is no amount of volume in the blood. There is no amount of liquid content in the body. So, there is oliguria and anuria. Uremia and rapid rise in blood. Urine osmolarity is less than 600 ml per osmol and rise in creatinine and urea level. The intrarenal cause is by ischemic and bacteria toxin drug. Increase intrarenal vasoconstriction. Tissue injury recovery phase. These are the phases in which there is intrarenal vasoconstriction is seen. It is inside the renal system, so it is intrarenal. This can be divided into three phases, which is oliguria phase, diuretic phase as well as recovery phase. Oliguria phase is less than 500 ml of the urine is excreted per day and urine contains WBCs and RBCs. The specific gravity of this oliguria is 1.010, lasts for 10 to 14 days. Diuretic phase, 3 to 5 liter of urine per day, 3 to 5 days. The fluid electrolyte replacement and dehydration and the hyponatremia, hypokalemia is seen. Recovery phase, there is renal dysfunction and the blood urea. The recovery phase is mostly due to the blood urea and serum creatinine GFR is normal. The treatment for this oliguria is hyperkalemia, which is there is increased potassium content in the blood, and insulin and the glucose together increases the uptake of potassium in the cells. And we should find the specific cause for the treatment: hypertension and the pulmonary edema. The antihypertensive drug, which is diuretics, and the renal protein level, which is dopamine, is used in vasodilation. Water electrolyte balance is given because due to the fluid loss, hyperkalemia and hypophosphatemia, which is we should give diet and calcium supplement, diet and phosphate binding agents. Protein, 20 to 40 gram daily is enough. In infection is due to antibody. In metabolic acidosis case, sodium bicarbonate is given 50 to 100 milligram per equivalent per hour. In diuretic phase, the fluid electrolyte balance and the glucose saline is both given. 3.0 gram NaCl and 2.0 gram Na sodium bicarbonate given in 1 liter of urine. 70 to 80 gram of protein per day is given. Fruit juices compensate the potassium loss. This is the diuretic phase treatment. We have seen all about the renal failure. Thank you. If you have any doubt on it, please do comment it. If you want any other topic, please do suggest in the comment box. Please do subscribe.